Hey everyone, welcome back to my channel. Thank you so much for joining me. As always, before we get started, if you could give me a like, share, a thumbs up, comment, hit that subscribe and notification button, I would appreciate it. What I wanted to do today, for those of you that are following the Lindsay Clancy trial, on Reddit, they had a pretty cool thing that I wanted to share with you. And it's actually, I think they probably do it every day, but I found it from yesterday, which was August 11th, and I believe it was day 11 of the trial. I have to think what day we're on now. But these are the key Reddit updates, and these are the major themes from live threads. And I thought that was interesting to go over. Let's see what the um, public is saying about this trial so far. So let's get right into this. So the first thing is provider treatment and documentation. Discussion of psychiatrist Dr. Tuff's notes and documentation practices. Many clinicians debate whether vagueness in notes hurt her in cross-examination. Quote unquote. I'm torn in that my teaching of documentation had been to be vague to protect confidentiality. It almost seems like that is coming back to bite her in the ass, that not everything was documented. Unquote. The next thing is systematic failures and communication gaps. Multiple commentators say fragmented record systems and lack of intra-provider communication contributed to missing flags. Quote unquote. Our healthcare organizations are a patchwork of systems that don't communicate, and the limits of confidentiality and family involvement. The next is mania versus depression debate. Observers argue about whether Lindsay exhibited mania, which is rapid, numerous messages, decreased sleep, or depressive symptoms. This split shapes interpretations of clinician responses. Quote unquote. So, are we all in agreement that the prosecution is proving she was manic with her interactions with Gelada? The next one is medication issues and doctor shopping claims. Redditors question the doctor shopping narrative for typical psychiatric meds. Many note most meds involved aren't taken for quote-unquote fun, and Clancy feared dependence. Quote-unquote. The doctor shopping is a weird take in general. You do that for opiates and painkillers, not SSRIs and anti-psych meds. The next one is about sleep deprivation as a red flag. Several users highlight severe sleep loss as a standalone serious clinical warning that wasn't adequately escalated. Quote unquote. The lack of sleep for this amount of time while reporting not feeling tired at all should ring alarm bells to every single provider involved. And then the next one is the witness's testimony and courtroom tone. So they go over Dr. Tuff's cross-examination. Many threads report Tufts was grilled about prescribing SSRIs and documentation. Clinicians defend standard of care choices and criticize the defense tactics. Quote unquote. Watching these videos of this brand new psych attending getting eviscerated for what I thought was pretty standard postpartum psych care is really sad. The next step is Nurse Gelada and mania signs. Some users view Nurse Gelada's testimony as indicating manic-like behavior, while others see her as likable and competent on the stand. Quote unquote. I find her pretty likable. And quote unquote. So, are we all in agreement that the prosecution is proving she was manic with her interactions with Gelada? The next step is the prosecutor and the defense conduct. Comments note interruptions and combative questioning by defense counsel and criticism of prosecutorial, oh my goodness, guys, demeanor. Quote unquote. Reddington continued to interrupt this witness's answers after being told many times to stop is frustrating. And quote unquote, the laughter by the prosecutors is in a murder trial is reprehensible. So I got to jump in here. I kind of like Reddington as an attorney. You can tell he's no bullshit. And the laughter by the prosecutors, they should have got their ass torn out. And why they didn't, I don't know. There's nothing funny about this. And if they can't do their job, and if they can't do their jobs correctly, maybe they need to find a new career. Like I said, there's just nothing funny about this. And I'll leave it at that. The next one is the public reaction in professional communities. The clinician community backlash. Medical professionals express alarm that public commentary may misrepresent evidence and discourage appropriate treatments like SSRIs in postpartum care. Quote unquote. So many lay people in the comments. I can't imagine being in tough shoes, and it scares the hell out of me to practice medicine in modern day of misinformation and witch hunts. The next one is mixed opinions on responsibility. Reddit discussions show a range. Some blame system provider failures. Some emphasize patient anatomy and possible intentionality. Others call for nuanced understanding of crisis versus routine care. Quote unquote. Yeah, it feels like the prosecution doesn't know exactly what case it is they're making, while the defense is extremely clear. And then what to watch next. So the upcoming phases, there's more testimony, or key testimony, I should say, coming up on different doctors, things like that. And then don't forget, we also had the defense coming up. That's the one that I am so looking forward to. I want to hear the defense. But the potential key testimony, expect to hear more on sleep, medication timelines, inter-provider records, and expert psychiatric witness testimony about postpartum psychosis, mania, and medication effects. Quote unquote. Sullivan has now allowed Dr. Elizabeth Lapasada to testify about the wounds and injuries sustained by Clancy. So here are two comments that I wanted to read to you. And there was pretty good information in here. It's a good opinion. So the one was, she has access to help. No one is denying that. But was it appropriate help for her presentation and worsening condition? The first bout of SSRIs, I think sertraline, seemed to be appropriate and standard if we're assuming she was presenting with symptoms of anxiety and depression. The fact that she didn't sleep for 48 hours after taking that should have raised alarm bells. Prescribing fluoxetine after this and other symptoms of racing thoughts, paranoia, etc., in my opinion, this was absolutely the wrong move. It seems Nurse Gelada recognized this, hence the introduction of quetiapine, and talks of bipolar 2 diagnosis, possibly thinking along the lines of mania and rapid cycling, mixed episodes, but unfortunately too little too late. To my understanding, the mother/baby unit declined admission, saying this was out of their scope, which is really telling and a responsible move on their part. We have the luxury of hindsight, blah, 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 but I don't see why admission into inpatient care, even voluntary, wasn't pushed more at the point antipsychotics were being introduced. And then this is the other comment that I wanted to tell you. I noticed this listening to Dr. Tufts and then Julie Paul, but listening to Rebecca Gelada today made it overwhelmingly clear that they all reported that Lindsay was extremely worried about side effects and becoming addicted to medication, yet didn't clock this as delusional thinking or at the very least clinically significant. When you have a patient that is taking every med for a couple of days, then saying it's making her ill, they're obsessed with the idea that they're going to become addicted to a medication against the evidence. They're saying they're having a terrible intrusive thoughts and they are afraid. They're not sleeping and specifically are reporting saying suicidal SI. Sorry about that pause, guys. Suicidal intention. Midlife brain. You need to be picking up the phone and referring her to a program yourself. Not a pamphlet, not a here's an inpatient program you should check out at your leisure when you're done skiing. I thought no one caught Lindsay's paranoia and delusional thinking because it had the appearance of quote unquote normal worries at the surface. It's reasonable that a postpartum mother and a nurse do not want to be addicted to medications. It's not reasonable to be Googling benzos obsessively every night and ruminating constantly that something bad is going to happen and being outright afraid that you will become addicted despite the low dose you are on, and your doctor reassuring you that you are not a bad person for taking them, especially not for an extended length of time, in this case several months. I was extremely surprised by the number of times Gelada was told there was suicidal intentions, but she didn't act on it at all. Like, okay, I get not wanting to add stigma to PPD and PPA, but telling Lindsay that these things were completely normal was not it. At a certain point, you have to say, all right, you are very ill, and we need to get you a higher level of care. The on and off again medications from all the providers was frankly insane. While yes, Prozac is considered a safe medication, for example, it's still impacting your brain chemistry. Seroquel is an antipsychotic and those impact people in various ways, usually not in great ways, even if it does help with the core complaints. Blunting is a major side effect of most antipsychotics, for example. For some, they can become disoriented. So she's taking meds and stopping meds that are significant, and these providers are not communicating with each other. Her brain is going through chemical whiplash on top of her underlying illness. Recipe for disaster. And I do want to say that the more we learn about Patrick's behavior during her care timeline, the more I understand him to be a source of stress and not real support for Lindsay. He feels that she's taking meds because her friends are. He tells Gelada she is not bipolar. He never mentions that Lindsay had HI towards the children to any provider, which would have altered her care plan positively, in my opinion. It's easy to infer he was partly to blame for her obsessive thinking around not getting addicted to benzos from how he acted. It seems he was facing pressure at home to get better as quickly as possible, and that may have contributed to the illusion of Lindsay wanting quote-unquote quick fixes for her mental health condition. So I personally didn't get that feeling about Patrick, but apparently some others did. And here is the subreddit under that comment. Um, some people actually do agree. It said, yesterday I got the feeling Patrick had a lot to do with some of Lindsay's behaviors. I also had the impression he wanted her to go back to work soon. If memory serves, he told her something along the lines of, quote unquote, why would you want to be home all day? That might be a reason why they seem to look for a quick fix. For a while, I thought Lindsay wasn't 100% transparent with her healthcare providers, fearing judgment or something like that. But now it seems to me she was also worried this could lead to diagnosis and or treatments Patrick would be against. I don't know how comfortable she felt to open up during online sessions if Patrick would be around. If that's true, to some extent, Patrick disrupted the kind of care Lindsay received. While both of them lost their children and both will feel the pain forever, Lindsay is paralyzed and facing the possibility of jail. Meanwhile, Patrick quickly started a new family. I was totally against judging him for this, but Lindsay took the biggest hit, and it's so tragic if Patrick really had something to do with this outcome, even if indirectly or unintentionally. And then the last comment was under that, and it said, and this was about Patrick. It said, I thought so too. Her fears about becoming addicted to medications, despite the low dose and the fact that she was only taking them for a few days, seemed like massive red flags, especially since she was a nurse and had some education and experience in the medical field. Her knowledge bank, paired with continued reassurances from providers, really seemed like an indication of irrational thinking, possibly bordering on delusion. They also kept harping on the fact that she would take a med for a few days, then switch to something else. She did that over and over again and continuously talked about needing something to work fast. Again, as a nurse, she would have had basic understanding that that's just not how psych meds work in general. To me, that says one of two things. Either her symptoms are so distressing to her that she was desperate to be quote unquote fixed, or she was experiencing mania and it manifested with medication hopping, almost like how a person in a manic episode will start a project after project after project. She seemed to be doing that with medication. So regarding Nurse Gelada, um, there's two comments on this. It said, I am absolutely perplexed as to why the Commonwealth called Gelada as their witness. She essentially testified multiple times that Lindsay had a mental defect of some sort and that she was considering rapid cycling, mixed state bipolar disorder, which can be unpredictable and erupt in psychotic symptoms. I don't understand how this witness fits in with proving the prosecution's case at all. And then the answer to that was, she didn't. I think she was very damaging to the Commonwealth and also presented a very different picture than Dr. Tufts, which makes me question Tufts' observations. The number of MyChart messages, which medication providers can charge insurance for and get paid for, is excessive and alarming. This was the primary form of contact Lindsay was having with a brand new prescriber. She had what, 3 actual appointments with Gelada and a million MyChart messages? Gelada wasn't actually getting eyes on her patient, either in person or virtually, given Lindsay's level of panic and decompensation. She didn't want to see if her speech was pressured or her thought process linear or anything else. That is wild. And then this one says, should Gelada have put a stop to the excessive messaging? I feel like it went above and beyond what is appropriate for a patient and a provider. like when Lindsay was leaning too hard on her for support and reassurance when she should have been reaching out to more appropriate people for that. And then someone commented under that, hindsight is 2020, of course, but I would have put a stop to it as much earlier and insisted on an urgent, perhaps same day or next day actual appointment with the client. To me, this is an unusual amount of reassurance seeking and contact between visits. Again, it's easy to sit here from my keyboard and judge in retrospect. I also take into account that Gelada said patients were often this acute. I'm not sure I buy that, but our patients that we work with are highly acute and still don't contact us this much unless something is terribly wrong. And it's also clear Gelada thought Lindsay was in a crisis. Anyhow, the part that is so fascinating is that if you look at the publicly published Medicaid slash mass health reimbursement rates for these services, it adds up quickly. Private insurance companies often base their reimbursement rates on Medicaid mass health rates, and facilities like South Shore Health, where Gelada work, can negotiate higher group and facility rates than these. That said, these public rates provide a benchmark. A highly complexity med consult established could be reimbursed at $134.43 plus $55.55 for 17 plus minutes of quote unquote therapy, plus $34.98 for 21 minutes of my chart messaging per every 7 days. A psychiatric nurse practitioner would theoretically make around $224.96 for less than an hour of patient interacting. That's for one patient. Imagine seeing 50 to 60 patients a week. All right, so let's just go over that. And through all that, $224.96 for less than an hour's work for one patient, and they're seeing 50, 60 patients a week. Is money talking or what? I mean, again, I've said this before, and I don't care if a hospital is saying they're nonprofit. Bullshit. They are a business. They're there to make money. And I think this proves it. Let's continue. Of course, I'm willing to be corrected by any prescribers because I don't bill their EM code, so I might have the system wrong. But compare that with the mass health rate for a 53 plus minute therapy session with an actual therapist, and therapists are only paid $108.09 for an hour of therapy, less than half what a medication prescriber can make in the same amount of time. Again, each plan, provider, and facility and how they bill will vary, but I just checked my own Blue Cross Blue Shield reimbursement for my med prescriber, and they were paid $152.18 for a brief video med consult with me. So these numbers seem roughly accurate. So there's a lot of different it seems like there's a lot of different public opinions out there. It seems to me, and this is just my opinion, it seems to me that the Commonwealth is not putting on a good case, and I could be wrong here, but now we're really, really questioning our healthcare system and the mental health. I'm getting really, really interested and excited for the defense. I'm over the prosecution now. I want to hear the defense's side. So Let me know what you guys are thinking about this and what your opinion is. That's public opinion per Reddit, and I thought that was a really good. We're not even halfway through this, guys. We have a while to go, but I thought it was a real good interpretation of so far of how the public is hearing about this, what they're thinking, and actually what other healthcare professionals are thinking. So, all right, guys, we'll talk soon. And as soon as I have today's uploaded, I will let you know. All right, have a great day. Bye.